Now, health expert and vice president for research at the South African Medical Research Council, Professor Jeffrey Mphahlele, is on Skype right now, and he joins us to share some of his thoughts on this story. Professor, a very good evening to you. Thanks for joining us, and a warm welcome to the Globe.
Thanks for having me, Mphahlele.
Well, it's an absolute pleasure. Well, we see more restrictions being imposed. We've seen, the alcohol ban imposed. But we still continue to see horrific figures still on the rise on a daily basis. Professor, is this perhaps the clearest indication yet that this virus is now slipping through our fingers?
So we have got a full-blown community transmission. And we also know that we have people who are not just adherent to non-pharmaceutical interventions. So combined, these factors, you can be sure that we still have a long way to go to contain the disease.
Still a long way to go. What needs to be done?
Obviously, we need biomedical intervention. We need a vaccine. But even when we have got a vaccine, it will take several months before the vaccine can actually interrupt the transmission cycle of the virus. So we need the vaccine, but at the same time, we need to make sure that we adhere to non-pharmaceutical interventions.
All right, Professor, we'll talk about the vaccine in greater detail in just a moment. But this talk of a third wave and possibly a fourth wave around May. And one then wonders, we are, well, in the peak of summer, but we've seen the second wave and we've seen alarming rates. I mean, what could possibly, make us to wait for this third wave?
Well, at the moment, we don't know whether we will have a third wave. We just assume that a third wave will come because we have not passed our winter period. So it could be that after the second wave, if we are very religious with non-pharmaceutical interventions, we can interrupt the third wave. Or if it happens, it is mild. So we can't talk much about the third wave at this stage. So we just have to really emphasize what needs to be done at the moment, because we need people to adhere to non-pharmaceutical interventions.
What do you make of the fears of the current vaccines that we are expecting, of course, that will hit our shores, may be less effective against this new variant?
The vaccine is fine. You can be sure of that. The efficacy ranges from 62% to 90%. So the average efficacy is about 70%. And we are talking about the AstraZeneca vaccine that is manufactured in India, Serum Institute of India. That's the one that the government has announced that it will come to South Africa for the healthcare workers. So the efficacy is okay. And in fact, if you look at what the World Health Organization has suggested in terms of efficacy of a COVID-19 vaccine, they set the target of 50%. So this vaccine is way above that.
Is South Africa in a position to support those who have lost their income? And as we've moved to level 3 of this lockdown and some people, have had their salaries cut, can South Africa be in a position to support those?
Well, I don't know. I can't speak on behalf of the government, of course. I just hope that the government will find some resources to keep those who are unemployed and give something to them, because it will be a disaster if they don't get anything.
All right, Professor, great chatting to you. Thank you so much for your update.
Thank you very much.
All right, that was Professor Jeffrey Mphahlele, the president of the South African Medical Research Council, joining us via Skype. Let's take a quick break. We'll be back in a moment.